Welcome back. I'm Dr. Andrew Torchio, Clinic Director at Pangea Chiropractic, and let's talk x-rays. You see, I don't want to take any chances with your health. That's the reason why x-rays are so vital in getting to the root cause of whatever it is you're experiencing. One of the major issues or concerns that I have is that many of my patients come to me and have lots of experience in working with healthcare providers, including other chiropractors, yet very few of them actually had worked with a chiropractor or healthcare provider who really understood and studied exactly what was going on. We take high definition digital x-rays at Pangea Chiropractic, and let me show you exactly what it is that we look for when we sit down and we have our consultation with you. After taking our x-rays on site, what you can see here is a real life patient of mine where we're studying the lower back. Now this is a front to back picture, and I understand that you maybe have never seen an x-ray of a spine before, but this is a front to back picture of the lower body, the pelvis. This is the left side of the pelvis, this is the right, there's the left hip bone, here's the right hip bone. So we're studying the lower back, and what we found on this patient was, number one, no one had ever taken x-rays, and number two, we found that this patient has a very significant curvature in her lower back lumbar spine, which we later found to be the root cause of why she had chronic low back pain. Here you can see how the spine is leaning and tilting to the left, a big curvature, a 10-degree curvature there that was undetected her entire life. Number two, you can see the major imbalance of the pelvis, an 8.3 millimeter lean, which is why we also found that she was carrying up to 15 pounds more weight on the left side of her body, leading to other things like foot and knee pain. You see, we don't want to take any chances. When we see the x-rays, we can fully understand where your problems are coming from, and then we can fully develop a specific treatment plan to get you back to living your life. In addition to taking this picture, we do these lateral bending x-rays. We refer to them as motion x-ray studies, where the patient bends to the left, bends to the right. We're looking to see which bones are moving versus which bones are not moving. The bones that are moving, we leave them alone. But the bones that are not moving are where the problem lives, and we can very vividly and clearly understand the angulation and tilt and movement patterns of your spine. It makes perfect sense because then we can get in there and do our work so that you can start feeling and moving better. We also bend to the right. We study the measurements of how the spine is moving so that we know specifically which bones need our attention. Lastly, we take a side x-ray of the lower back so that we can understand what is happening in between the bones. In between the bones is where the disc lives. And if the disc is getting irritated and compressed, we can see that on our x-ray, areas where the body has been compressing and starting to have degenerative processes. If we see that, we can make it grow back, but we certainly then know how to custom tailor our adjustments to help decompress and pull stress off of those parts of the spine so that those nerves that maybe you're feeling getting irritated and kinked can get relieved and you can stop feeling so much pain and agitation down there. You see, the key is to take the time in the beginning to understand what your spine and lower back is telling us, and not guess and not take any chances. So every single one of our patients will go through this very detailed history and examination so we can very specifically understand where your body is uniquely challenged and stressed so that together we can get results.